It's kind of weird that women can just get diabetes when they're pregnant, right? But there are 10% of you out there who are going to have gestational diabetes, and there's no good reason for it. So whatever you eat and whatever goes into your bloodstream crosses the placenta and goes to the baby. So essentially, all that excess sugar that you're getting is going to your baby. The biggest risk, and I know this is a scary thing to say, and yet I want you to understand the risk. Not only does gestational diabetes pose risks during your pregnancy and your birth, it also can lead to lifelong health implications for you and your kiddo. Is the biggest reason we as healthcare providers really care about this disorder. And ultimately, our goal as healthcare providers is that you end up with a healthy you and a healthy baby. So your OB provider is recommending you get tested for gestational diabetes. And maybe you're really dreading the test. And maybe you're wondering why you, as a normal, young, healthy person, actually need to get tested. Maybe you heard the test is awful and you're afraid you're going to vomit it all up. Either way, in this video, we're going to go all through what gestational diabetes is and what it isn't. We're going to go through the testing process, what the options are, and if you can choose something other than that horrible drink. And we're going to talk about the whys. We're going to talk about the risks associated to you and your baby with gestational diabetes. My name is Megan Galloway. I am a certified nurse midwife, and I have been in this OB world for 13 years now, I think. And almost daily, I talk to women about gestational diabetes testing and why it's so important for them. And some people get it, and some people are concerned about the testing and don't understand why they do it. And so my hope is by the end of this video that you'll understand what it's all about and why you should get tested. So let's start with, what is gestational diabetes? It's just what it sounds like. It is diabetes of pregnancy, and it's diagnosed during your pregnancy, not before your pregnancy. So if you already have pre-existing diabetes, you have type 1 diabetes, you have type 2 diabetes, you will not ever get gestational diabetes because you already have diabetes. But when we talk about gestational diabetes, we're talking about testing that we do during your pregnancy to test for this diabetes that only happens when you're pregnant. It's kind of weird that women can just get diabetes when they're pregnant, right? But the way that pregnancy works is that the hormones that your body produces during pregnancy can actually increase your risk of insulin resistance. And for those of you who have heard of insulin or not heard of insulin, basically insulin helps transport sugar or glucose into your cells. And when your body is resistant to insulin, then all that sugar goes into your bloodstream, and then you get high blood sugar, which is diabetes, right? Globally, the prevalence of gestational diabetes is about 17%. But with especially all these health complications that we have in the United States and probably around the world as well, those numbers continue to rise. And because the prevalence is not a low number, that's why we recommend getting tested. So we're going to talk about testing next. Now, there are a lot of risk factors for diabetes in pregnancy, gestational diabetes. And we're going to go over those here at the end of the video. So make sure to stay tuned because you want to know if you're at risk for gestational diabetes, right? About 90% of women who get diagnosed with gestational diabetes do have at least one of those risk factors, but there are 10% of you out there who are going to have gestational diabetes, and there's no good reason for it other than the fact that you're pregnant, which is why testing is so important, even for all you young, fit, healthy women. So how do we do the testing? Well, the gold standard is something called a glucose challenge test, and it's basically where we give you a jug of sugar water and we make you drink it in about 10 minutes or so, and then an hour later we test your blood sugar. And if that blood sugar is elevated beyond a certain number, people use different numbers, it's usually anywhere from 130 to 140, then that means that you're at an elevated risk for gestational diabetes. And then we make make you do a 3-hour test. And I'm really sorry if you have to do that one. And the 3-hour test is we'd make you drink double the amount of that sugar water, and then we test your blood over a 3-hour period of time while you're fasting. So hopefully you don't have to do that test, but you might have to. So that's the gold standard. There are 2-hour tests out there as well. And then for women who really don't want to do those glucose drinks or are afraid they're going to vomit it, there are other options out there. There's this really cool one these days that you can actually order for yourself on the internet. And I think some offices are providing it for their patients if they want it. It's called Fresh Test. And there's both a 50-gram load, which is for the 1-hour test, and a 100-gram load, which is for the 3-hour test. And you can order that online. I'll put the link in the description. And it is an approved way of testing for gestational diabetes that is a little bit more tolerable for people than doing the, sugar water that we give you normally. For people who don't want to drink a drink at all, or for those of you out there who've maybe had bariatric surgery and can't drink those drinks, then we give the option of doing finger sticks. And so if you've ever known anybody with diabetes, then they might have to test their blood sugar before, when they wake up in the morning or after each meal. And that helps them know if their blood sugar is in range. So you get a little kit, you poke your little finger, and you test your blood sugar 4 times a day. And we usually have you do that for about a week or 2, 4 times a day. And then we have you take a log of what you've eaten and what your blood sugars are. And if you pass that test, then you don't have gestational diabetes. And if you don't pass that test, then, well, you do. They have now actually approved those cool continuous glucose monitors that people wear usually on the back of their arm, and they have an app associated with them. So instead of having to poke your finger 4 times a day, if your insurance approves it, or even if they don't, you want to pay for it, you can use that continuous glucose monitor instead of a traditional glucometer, which is that bulky thing where you have to poke your finger. And that can help you to track your blood sugar for 1 to 2 weeks to diagnose gestational diabetes. Timing of testing is important. For those of you with risk factors, we are usually going to recommend that you get tested early in pregnancy. And for those of you who don't have risk factors, you usually only have to get tested once during pregnancy. And that's typically between 24 to 28 weeks. So if you're approaching that point in your pregnancy, just get ready. Your provider is likely going to talk to you about doing testing. So if you're thinking you want an alternate, you might want to start looking into your alternate options. Now, I told you we'd talk about the risks, right? Why is this important? Gestational diabetes is actually pretty serious if it's left unmanaged. And so we'll get into why it's actually important and the safety implications for you and your baby. But first, I want to talk about the risks the risk factors that you might have that could potentially lead you to getting gestational diabetes. So some of those risk factors are having prediabetes, and then it kind of turns into gestational diabetes during your pregnancy. You could have PCOS, which is often associated with insulin resistance and can sometimes lead to gestational diabetes. You could have a family history of diabetes. And usually what we're looking for in that is a first-degree relative, so parents or siblings that have diabetes. And it's actually higher risk that you develop gestational diabetes if they have type 2 diabetes than if they have type 1 diabetes. Of course, there's, if women are over a certain BMI, over a BMI of 30, that poses an increased risk of gestational diabetes. If you're over the age of 35, you have an increased risk. Certain ethnicities have an increased risk of diabetes as well. And so does, if you had a really big baby in your last pregnancy, because maybe you actually had gestational diabetes and we just didn't catch it and your baby grew really big. And so we want to test you early this next time for your pregnancy. Speaking of really big babies, that is one of the risks associated with gestational diabetes. So we're going to get into that next. So there are risks to you and your baby. And one of them is that this unopposed blood sugar essentially is getting to the baby. So whatever you eat and whatever goes into your bloodstream crosses the placenta and goes to the baby. So essentially, all that excess sugar that you're getting is going to your baby, which can make them grow very big. And that can pose some serious health risks to your labor and birth experience. So you are at higher risk for a C-section if they don't fit through your pelvis because they're too big. You're at higher risk for something called shoulder dystocia, which is this really scary thing where the baby's head comes out vaginally, but then the shoulders get stuck. And we'll go into that topic a little bit more in depth in a different video. There is a risk for babies afterwards that they actually have low blood sugar when they're born, which can seem kind of counterintuitive, but what happens is they're so used to getting so much blood sugar from you that their body produces all this insulin. And then once they're born, they're not getting that excess sugar, but their body's still producing all this insulin. And so their blood sugar actually drops. And then they could actually need to be in the NICU for a while if their blood sugar isn't well controlled after birth. So we're looking at birth risks and we're looking at risks to your baby. And those are just not great things. The biggest risk, and I know this is a scary thing to say, and yet I want you to understand the risk. If you have gestational diabetes, and you don't test for it, or you do test for it, but you don't control it, and it is wildly out of control, your blood sugars are wildly out of control, that can impact your placenta so much that the risk is actually stillbirth. And so that is the biggest reason we as healthcare providers really care about this disorder, is because we want you and your baby to be safe and healthy. Not only does gestational diabetes pose risks during your pregnancy and your birth, it also can lead to lifelong health implications for you and your kiddo. And so it's really important to try to do your best to eat healthy and exercise during your pregnancy, because that can actually decrease your risk of developing gestational diabetes. So for you, you're looking at an increased lifelong risk of type 2 diabetes if you have gestational diabetes during pregnancy. And you're also looking at a significantly increased risk of heart disease later in life. For kiddos, they are actually at higher risk of developing type 2 diabetes in their future as well. And they're at higher risk for things like obesity and high blood pressure. So super, super important that we catch this, super important that we manage it. And ultimately, our goal as healthcare providers is that you end up with a healthy you and a healthy baby. If you've learned nothing else today, I hope it's that gestational diabetes testing in pregnancy is really important, and I hope you understand the why of that now. And I also hope you've learned that with your pregnancy and your healthcare in general, there are always options. So if you don't think that what we're recommending is the right thing for you, talk to your healthcare provider about an alternative option. This isn't just for gestational diabetes testing. It's for a lot of things in healthcare. Make sure that you're advocating for yourself so that you're doing what's best for you in a manner that feels right to you. Maybe you've had gestational diabetes in the past. Maybe you're worried about the testing in the future. And maybe you just have questions for people out there about what their experience was like with blood sugar testing and possibly having to have medications for diabetes and things like that. I encourage you to leave any questions or comments in the comment section. I would love to hear from you. And in the meantime, if you want to learn more about that little acronym I mentioned, PCOS, I have a nice little video here about PCOS for you. Stay healthy, everybody.